This is Dr. Serkan Balta. I'm a plastic surgeon working in Istanbul, Turkey. Now, our main goal is to explain you what is high-def liposuction or liposculpture. So, in some patients, in all patients, they're looking for a nice shaped and athletic view. But this high definition or liposculpturing is not suitable for all patients. If you want to give a shape to a body, the first thing you need a nice anatomy on the patient. For example, if the patient doesn't have enough volume on their muscles or if they are untrained, so giving shape just with the fats, removing fat and adding fat is going to be a fake view. So what you have to achieve in this surgery is, if it's an athletic shape, the patient has to be athletic first. So what we do in this kind of surgery is we always give the shape with all areas liposuctioning first. You have to take all the fat in medium and in the deeper layers of the fat. First you have to get rid of all the fat what they have. And second thing what we do is we just give some shadows to the muscles. We know their attachment points, we just palpate it during surgeries, we feel it, and we just give the directly original shape to the muscles. It's not a fake surgery. You cannot imagine like a painting. You have to feel the real anatomy and you have to give the shape of the real anatomy. So what we do is we just give some definitions to the muscles with removing extra fat on the attachments of the muscles to give shadows and also the lightening, the shadows and everything is important in this surgery. You sometimes leave little extra fat in some zones and sometimes you remove all the fat and make skinny all the sides. So when you're doing this surgery, if you leave so much fat in one side and if the patient gains weight, so the look is going to be not nice, it's going to be so unnatural and so fake. That's why in these surgeries we always remove every fat cells around this area in deeper layers, and for the superficial layer we sometimes remove some fat, we sometimes leave some fat. Just it's up to your anatomic decisions. So this surgery cannot be done to every patient that they come to us, and it just can be done in specific patients. If we can palpate, if we can just touch their muscles and if we can feel them easily, then we can do the surgery. Okay, so the important thing is the good choice of the patients and of course a good choice of the surgeon, because it's not so easy. The surgeon has to know a lot about that anatomy and the surgeon has to understand the levels of the fat cells, because sometimes you take some extra fat, sometimes you have to leave some fat, and you have to be so sensitive about these conditions. So if you want to achieve an athletic body and if you want to do a high definition surgery, the surgeon has to choose the right patient and the patient has to choose the right surgeon. It's both the same. If they have a good comparison, so the result is going to be probably the nice. But the most important thing is also the aftercare about high-def liposuction, and the patient, if goes on the gym and do sports nicely, always the athletic view is going to be more defined after surgery. So half of the results with high definition is up to your surgeon, half of the result is up to yourself. So if you take care of the body after surgery also, so it's going to be really nice and it's going to be you can use that body for all over your life.